Welcome everyone. This is USMLE with Varun. This is part of our psychiatry series for USMLE Step 1. In this video, we will start from absolute basics and slowly build clinical reasoning. Even if psychiatry feels confusing now, by the end, you will understand how to approach questions logically and confidently. Before all this, I ask you to subscribe and support my channel. This is an open access edu platform for everybody who are preparing for USMLE and if it helps for anybody else too. So this lecture series is provided free and open access for all students. There are no paywalls or mandatory fees. If you find it useful and wish to support its continued development, voluntary contributions are welcome. All content will remain free to access. If you want to pay, link is in the description. You can pay via UPI, cards, net banking, wallets, and PayPal. So, what you will be learning today? In today's session, we will cover basic psychiatric terminology, how USMLE designs psychiatric questions, a step-by-step solving method, brain, chemicals and drug logic, depression and anxiety fundamentals, substance use patterns, and multiple USMLE style questions. What is psychiatry? Psychiatry is the study of how the brain affects emotions, thoughts, behavior, perception, and cognition. Any psychiatric symptom you see in exams will belong to one of these five categories only: mood, thoughts, behavior, perception, and cognition. Common terms you must know. A symptom is what the patient feels, like sadness, fear. A sign is what we observe, like tremor or agitation. A syndrome is a group of symptoms. Diagnosis is a disease name. Acute means sudden onset. Chronic means long term. These words appear frequently in exam stems. Why psychiatry matters? Psychiatry is heavily tested because medications directly affect brain chemicals. Psychiatric emergencies can be fatal. Many medical diseases look psychiatric, and drug side effects are commonly tested. How USMLE tricks students. USMLE commonly hides diagnosis and time duration. USMLE uses long stories that hides the key clue in the timeline, the medication history, or one abnormal symptom. Our job is to ignore noise and find the pattern. Mastering framework, which is a very important thing. You need to memorize this flow. First, you need to identify the domain, then identify the timeline. Then you need to rule out medical causes, match diagnosis, and then choose treatment. This works for almost every psychiatric question. Identify domain. Ask, is this mainly mood, thought, anxiety, cognition, substance, or behavior? This narrows 80% of diagnosis initially and instantly. Timeline clues. Duration is extremely important. Acute hours suggest intoxication, days suggest withdrawal or delirium, 2 weeks suggests depression, 6 weeks suggests anxiety or schizophrenia, years suggest personality disorder. Coming to medical red flags. Always think medical if there is fever, new medication, drug use, older age, fluctuating consciousness, abnormal visits, or neurological signs. Screening tools. PHQ-9 screens depression, GAD-7 screens anxiety, MMSE screens cognition, CAGE screens alcohol. You don't memorize questions, you just need to memorize the purpose. How psychiatric diagnosis works. Diagnosis uses symptom cluster, duration, effect on daily life, and excluding medical causes. Coming to neurotransmitters, Serotonin controls mood and anxiety. Dopamine controls pleasure and psychosis. Norepinephrine controls alertness. GABA calms the brain, and glutamate excites the neurons. Drug logic. SSRIs increase serotonin. SNRIs increase serotonin and norepinephrine. Antipsychotics reduce or block dopamine. Benzodiazepines increase GABA. What is depression? Depression is a medical illness, not weakness or sadness. It lasts at least 2 weeks and affects daily functioning with physical and mental symptoms. Side caps. You can memorize the effects of depression by using the mnemonic SIGCAPS, SIG caps. So, S is sleep disturbance, I is loss of interest, G is guilt, E is low energy, C is poor concentration, A is appetite changes, P is psychomotor changes, and S is suicidal thoughts. Sleep, loss of interest, guilt, low energy, poor concentration, appetite changes, psychomotor changes, suicidal thoughts. Coming to depression treatment, first line is SSRIs, second line is SNRIs or bupropion. Severe or resistant cases, we can use electroconvulsive therapy. SSRIs side effects. Common side effects include nausea, sexual dysfunction, weight changes, initial anxiety. They take 4 to 6 weeks to work. Watch young patients for suicidal thoughts. TCAs and MAO inhibitors. TCAs cause side effects like dry mouth, arrhythmias, sedation, and fatal overdose. TCAs cause anticholinergic effects and dangerous arrhythmias in overdose. You need to remember this. MAO inhibitors cause hypertensive crisis with certain foods and drugs. Anxiety disorders. Panic disorder has sudden attacks. GAD has chronic worry. Social anxiety is fear of people, and phobia are fear of specific objects. GAD is generalized anxiety disorder. Panic disorder. Panic attacks cause sudden palpitations, sweating, chest pain, fear of dying, or fear of dying, and they tend to resolve in minutes. Generalized anxiety disorder involves excessive worry for more than 6 months, muscle tension, fatigue, poor sleep. Risk factors for GAD includes genetic predisposition, brain chemistry, family background, social influence, and lifestyle factors. Substances can cause depression, anxiety, psychosis, delirium, seizures, and death. Always ask the patient about history of drug abuse. Alcohol pattern. Intoxication causes slurred speech and ataxia. Withdrawal progresses from tremors to seizures to delirium tremens. We need to treat this alcohol pattern with benzodiazepines. Opioid pattern. Intoxication causes pinpoint pupils and respiratory depression. Withdrawal causes diarrhea and muscle pain. Treat overdose of opioids with naloxone. Benzodiazepine pattern. Withdrawal from benzodiazepines is dangerous and can cause seizures. Stimulants. Cocaine and amphetamines cause hypertension and psychosis. Withdrawal causes depression and fatigue. Now let us see three pattern recognition cases. So case 1, 3 weeks of sadness, poor sleep, and loss of interest equals major depressive disorder because duration is over 2 weeks, and SIGCAP is what we have discussed. SIGCAP's features of depression that we have actually discussed in this video. There are features of psych-catch features that are seen in this case, like mood disturbances, sleep disturbances, lack of interest, and timeline. You need to check that, you need to see and observe the timeline. It's greater than 2 weeks, so you can diagnose it as major depressive disorder. So this is one of a case of pattern recognition that can be helpful for USMLE Step 1 questions. Pattern recognition case 2. Sudden fear with palpitations and normal heart tests equals panic attack. Normal ECG with palpitations and sudden fear can outline us to a diagnosis of panic attack. Case 3. Confusion, fever, rigidity after antipsychotic use equals neuroleptic malignant syndrome, which is a medical emergency. Confusion, fever, and rigidity after using an antipsychotic can help us identify neuroleptic malignant syndrome, which is a medical emergency, and this needs to be treated as soon as possible. Medical conditions that mimic psychiatry. Always consider hypothyroidism, vitamin B12 deficiency, brain tumors, infections, and electrolyte problems, because all these conditions might mimic psychiatric conditions. Question 1. Patient with fatigue, constipation, cold intolerance plus depression. There is fatigue, there is constipation, there is cold intolerance, and there is depression. When there is something like cold intolerance, you have to suspect something related to thyroid dysfunction. So the next test that you have to do is TSH, thyroid stimulating hormone. When it is tested, we can identify if there's any case of hypothyroidism. Question 2. Sudden fear with sweating and normal vitals later. We can diagnose panic disorder out of this. Question 3. Alcohol stopped 2 days ago with tremors and hallucinations. We can come to a diagnosis of alcohol withdrawal delirium because there are hallucinations, alcohol was stopped 2 days ago, and there are tremors. Question number 4. A teen is on SSRI and he develops agitation and suicidal thoughts, needs close monitoring and dose adjustment. So when a teenaged boy or girl is on selective serotonergic reuptake inhibitors, when they develop something like agitation and suicidal thoughts, what's the action that we have to take is we need to monitor them closely and also adjust the dose. Coming to drug side effects. SSRIs can cause sexual dysfunction. This is the we all need to memorize all these important drug side effects because these are highly tested at USMLE Step 1 level. So SSRIs cause sexual dysfunction, TCAs cause arrhythmia, MAO inhibitors cause hypertensive crisis, antipsychotics cause EPS, benzodiazepines cause dependence. SSRIs cause sexual dysfunction, TCAs cause arrhythmias, MAO inhibitors cause hypertensive crisis, antipsychotics cause extrapyramidal symptoms like rigidity, and benzodiazepines cause dependence. Common exam mistakes are that the students ignore the timeline, forget substances, miss vitals, mislabel delirium as psychosis, and forget drug effects. We need to check if we are doing any of these when you're answering something related to psychiatry. We need to consider timeline seriously. We shouldn't miss substance use. We should look at vitals. We should not mislabel delirium as psychosis, and we should not forget drug effects. Quick revision. So, whenever a question comes up and you suspect it to be something related to psychiatry, you have to ask yourself, like, what's the domain? What's the time? whether it's an organic cause or not, whether there's any drug involved. It's an emergency. Psychiatry is purely pattern recognition, depending on these five things like the domain, time, whether an organic cause or not, whether there is a drug involved, and in case if it's yes, what's the drug, and whether it's an emergency or not. Time, symptoms plus drugs helps you find out the diagnosis. In next video, we will be covering psychosis, schizophrenia, delirium, and antipsychotic drugs. Thank you for watching USMLE with Varun. This channel provides free high yield education for everyone. Subscribe for the next part.